looks a little red. Okay.
We're live.
Hi, everybody.
Hello, everyone.
So
welcome to another episode of Skintox. I have Andrea on this side.
Hi, guys.
And we have Dr. Cody Hemsworth and Barb Hemsworth underneath us from Skinworthy. Thank you so much for joining us tonight, guys.
We're so excited. Thank you. This is great. This is really fun. What a great Friday night. Get away from the kids.
Exactly. What's better than being on Skintox on a Friday night, eh?
It's the best.
Oh,
you know what? We've been stuck at home during quarantine, so this is really this is a party.
Awesome.
I love it. You know what? It's an exciting week this week because the weather's getting better. All the provinces are starting to open. Clinics all around the country are starting to get into the swing of things. Patients are finally getting treated, which is wonderful. So I think it's a good time to celebrate. So I'm on the vodka waters tonight. So
still in the clinic.
I know.
I haven't left today because it's so busy.
Know.
So I've got my Perrier Slim can here from
I
the
think
cooler,
we do have some champagne in the fridge downstairs from a previous event. We could probably just sneak out, popcorn.
Yeah, exactly. Should have done that. I didn't plan for it.
Yeah.
We'll cheers to that anyway.
Yeah, cheers. So I'll hand it over to Andrea to get started, and I'm really looking forward to this because for those of you who are watching, I've never met these two before, so I'm really looking forward to it. I've done a bit of research about their clinic this week, and I can't wait to get to Toronto to actually come and see the clinic in person because you guys seem to be doing some awesome stuff, and I'm looking forward to hearing about it all tonight.
Thank you.
It's always nice to do that. I mean, it's our first clinic, right? And so it's, anyways, really nice to meet you, and thanks for having us.
No worries.
Yes. I mean, you guys, so your clinic is, and actually that's where we're going to start because we want to talk about your clinic and talk about kind of the history of your clinic, how that got started. I mean, it's beautiful. So just give us a little bit of background about how your clinic got started and what your clinic stands for and all that great stuff.
All right. So this actual location, this new clinic that we built, this is our second year here. Prior to that, though, while Cody was finishing up his derm diploma, I was practicing alone, and he was just my medical director. So I just had a small space, about 5 kilometers from here, and I was just a nurse injector just offering injectables, so Botox and fillers. And we were doing the FaceTime calls, and he was doing my medical directorship. And I built up a huge clientele in that short amount of time, and in that small clinic, only offering injectables. And then it was time to build the dream clinic. So we searched for a location, we found it, we built the place, and it was really nice to have a really big clientele already to move into this clinic, right? It wasn't just opening a fresh clinic and just waiting for people to come. We just brought everybody over, and Cody joined the practice. And I mean, the rest is kind of history.
Yeah. So it turns out it's a lot of work starting a clinic from scratch.
It's so easy. We just opened the doors and people came in.
Just put one Instagram post and had hundreds of followers, and it's just so easy. No, it's a lot of work. So yeah, that's the gist of how it happened, right? Barb started first. I've always loved doing procedures through medical, in medicine. And I just find I'm a very visual person, right? So this is a natural fit for me. I was a GP before. I did a derm diploma, gearing up for this. And then it's been just such a great fit for us, right? Barb and I both have a real entrepreneurial spirit. So we love working with the team and trying to create really good user or patient experiences in this case, right?
Of course, yes. And so Cody, you kind of really transitioned you're from GP over to kind of medical aesthetics. And so you deal a lot with you treat a lot of acne and stuff like that too, right?
Totally. Yeah. So all those kind of medical conditions that lend themselves so well to the cosmetic realm, I find are just kind of one of the best things to treat for patients. So as a GP, I found that it was kind of a struggle. You're always going through patients so quickly, and you never really get an understanding of how much their acne is actually affecting their daily life. And so here it's a slower pace, right? We have really good connections with our patients, and with more knowledge, right, about better ways to treat them, we're getting really nice outcomes for acne patients, right? And so I find that super rewarding.
That's awesome.
Yeah, taking the time to treat it both medically and with skincare, and
that's one of the biggest things. I think I don't think GP doctors really fully understand is that, like, yeah, you can write the prescriptions that, you know, that are on all the guidelines. Everybody knows them. You can all prescribe them, but you have to take the time to actually educate your patients on the right way to do it. And they're always missing the elements of skincare, right? No GP is ever telling you the right way to wash your face and then exfoliate and tone, right? Like, when was the last time you've heard a patient say that their family doctor told them that, right? So, I mean, that's an element that I find has been a huge element to our actual treatment of acne. And a lot of the times you're just minimizing the amount of like systemic pills and things that the patients are needing because they're just actually taking care of their skin. So it's worked really well.
And we offer in clinic treatments as well, like the dermal infusion and chemical peels and extractions and the blue light therapy. So we have many modalities to treat acne, and we have the time and we have the follow through, and there's a lot of hand holding as a part of it, and I think we can offer that.
Absolutely, yeah.
And I'm sure, Andrea, you see this all the time, right? Your patients come in for fillers, but their skin is in really rough shape, right? Like, it's fillers or Botox, but they actually need to take care of the sheets that are going over top of that mattress, right? That's always the analogy. You want it to look good, or it doesn't matter how comfy the mattress is if the sheets don't look good, right? So, I mean, that's been a huge element. And so acne as it stands, right? It's a chronic condition. It's going to fluctuate over time, and patients are going to experience different levels of it at different points in their life. And unfortunately, sometimes they get scarring as well. And that's where a lot of the different procedure modalities come in, right? So we try to be really a full-service, non-surgical cosmetic clinic, right? That kind of lends itself into that kind of skin dermatology medical realm. But we really keep the medical derm really light here, right?
Mm-hmm.
So for really serious medical derm stuff, we're just going to refer to it to our great colleagues that are around Toronto, right?
Yeah. Of course, yeah. And I mean, you guys have such a great presence online, and it seems like, and the work that you guys are doing there, your before and afters, I mean, they're really, really great. So keep up the good work. You guys are doing fantastic. Yeah, I love seeing it. I love seeing your posts.
Well, as you know, we see you at a lot of educational events, right? We're always seeking new education, new techniques, trying to learn the latest and the greatest. I mean, you can't stop in this industry. You can't stop learning. There's always new studies. There's new clinicians, new anatomists. Like, it's so important to stay very current in this industry.
Absolutely. So, doctor, nurse, married dynamic, how does that work?
It started off as being bartender and cocktail waitress.
Yes.
I just kept going to school, and then eventually became a doctor and nurse pair, right?
Yeah.
So we've been at this a long time. So
yeah, what are we, like 15 years together?
15 years together, and we've been married for 9, right?
Yeah.
So it's been a long time. Traveled around the world together, and now own a business together. So it is tough at times. As you can imagine, it's like you're always together, and so you're always bouncing ideas off each other, and she shuts mine down immediately. And I've got to fight for it. But overall, it's an incredibly rewarding experience when you can have that success together, right? And I think that's it. It just compounds on itself, right? You get little successes throughout the day, throughout the week, and then all of a sudden you look around, you have a very nice clinic that you're coming to every day, right? So I think
so nice.
Always really nice to work with Barb with.
And 2 little babies, right?
Yes.
2 kids. I have I just gave birth 4 months ago, so I have a 4-month-old.
Congratulations.
Congratulations. 4-year-old son. I mean, like, they're kicking our asses, but I mean, we're really passionate about what we do and this clinic, so we just try and give them all that we can at home, but we also have to come to work and focus. It's like another baby of ours, right? Like,
oh, you should see our son. He's 4 years old, and if you pick up that phone, he's ready just to smash it out of your hand.
Oh, yeah.
Mom's doing another post. Mom's doing another. I know.
Yeah.
That's how it happens, right? It's just like you're always thinking about the business. And you try to be present when you're at home, but it is a lot to balance for sure.
I know exactly what you're going through. I've got a 3 and a 1-year-old at home, and daycare's just opened this week in Ottawa, so it was like
lucky.
my wife and I could finally work without having the little rugrats running around screaming at us all day.
I mean, we always said that the daycare workers are actually saints.
Yeah.
They do it, and now we didn't sign up to be full-time parents.
No,
but. Anyway, it's more respect for daycare and teachers than ever, right?
100%. So talk me through, I'm a patient, I'm coming through your clinic, I'm coming into Skinworthy. What's sort of like the patient journey or patient cycle? How do you sort of do your consults and take patients through your clinic?
So it's actually changed recently. So it used to be that I did my own consults, Cody did his own consults, we did the education for our patients individually. But we have such a large multidisciplinary collaborative team that we decided to actually use our staff to help us with this, because we're becoming a really high volume clinic. Yeah. And I think the patients enjoy having multiple touch points in the clinic with different practitioners. So we've trained Megan, who is now our consultant.
Yes.
And she's been with us since the beginning, and she meets with the patient. She does an intake with them, understands their concerns, and really explores the possibilities with them of what can happen for them, whether it be fillers or Botox, different like treatments such as lasers, and starts there. Creates a treatment plan, and then we get introduced to the patient and we take it from there. So it's a really nice, light, non-intimidating experience for the patient firsthand, right? Because sometimes I think coming in just to meet the nurse or the doctor can be a little bit like, this gets a little scary, a little bit medical. So Megan is just has like a fresh way of engaging with the patient and educating.
Yeah, cool. So let's talk non-surgical cosmetics now a little bit. We live in a fascinating time in our industry, really. There's so much new innovative technology coming out. The education in this industry is just at a different level. I'd really love to know what are some of like the innovative procedures you're doing in your clinic. And I have a second part of this question as well. And what do you think are going to be some of the more innovative procedures moving forward in this industry?
All right. Big question.
It is a big question.
Unpack. Yeah. So this industry it's a really intimidating industry to get into initially, right? Because it's like, well, how do you do it? You go through a training center, you get some basic skills, but once you're in the industry, and I think Andrea, you can probably talk to this as well, is that there's so many wonderful, like good conferences, hands-on anatomy labs that we end up going to learn more, right? And so Barb and I always made a point of going to at least 2 international conferences throughout the year, some of the big ones in like Monaco or in the US. And then obviously being in Toronto, we're really quite spoiled for more education locally, right? So that works out really well. Now, on top of that, I think all of the companies that we work with, from a medical standpoint, working with companies sounds like the worst, right? Like from a historical medical standpoint, like the reps are just going to take your mind. But in cosmetics, it's actually extremely useful, right? Because they're bringing the experts either into your clinic itself or hosting events where you're learning hands-on or in large group centers, right? So I find that that's been really good. Now, what are some of like the really cool treatments that we do here?
Well, I think what it comes down to, what we're trying to teach our patients, is that aging happens through all layers of the face, and we're trying to treat that way. So you can't just address one layer. You can't just address with just fillers or a neurotoxin. We have to look at bone and how it ages, the deep fat pads, the muscles, the ligaments, the superficial fat pads, the skin. And I mean, if you start treating in combination, you'll get superior results. So that's what we're focusing on as a clinic, is really looking at combination therapies, staffing treatments, and addressing all layers. I mean, it gets to the point where a face can't handle more filler. So you have to look at other ways to make that face still look natural and achieve the results they want. So look at skin tightening treatments, or look at treatments that'll address like tone or texture of the skin, right? So here in our clinic, that's our main focus, is not just offering one modality or a repetitive modality, trying to shift patients and their thought process into other treatments to continue to get great natural results.
I love that answer, and I just want to speak to the viewers out there. This is something that is very consistent with all the physicians and nurses that we speak to on this show. Yeah. If you want to make changes to your skin, you have to do multiple modalities to get those changes happening, because there's a lot going on. And I just want to let viewers know that this has been a consistent thing coming from all our physicians and nurses. And I love that answer. Thank you so much. I'll hand it on to Andrea.
Yeah. Hey, wait. Roll back. Where's the industry going?
Oh yeah, where's the industry going? Yeah, sorry.
The second part.
Yeah, the second part is like, I mean, it's not just like trends in which parts of the body that we're treating. I think it's actually going to be modalities that we're actually doing or are going to continue to develop. So things like exosomes, so like little vacuoles that are going to be able to deliver cosmeceuticals to different levels or very specific spots, I think are going to be really cool. PRP, PRP has been around for a long time, but that whole branch of regenerative medicine, I think, is going to be something that's just really going to explode once stem cells get a few more safety studies under their belt, and there's not so many lawsuits in the US and that sort of thing. But that's going to be an area where things go. And then safety, I think, is going to be another one. You're going to see, I think, more imaging within the clinic itself. I mean, I'm really hot on the idea of getting ultrasound within the clinic, getting proper training on that, just from a safety perspective, especially for injectables, right? So I think that's going to be an area that we're going to start seeing grow.
I think that's a really big trend right now in safety and in clinics is ultrasound guided treatments, or even if you have a vascular occlusion, you can isolate it and treat it right on the spot and resolve it. So I think that's a really cool thing. And safety is a really big thing for us in this clinic.
Absolutely, yeah. Do you guys have ultrasound yet, or you're looking at?
We're looking at it.
Yeah,
starting to explore.
Exactly,
cool.
right. Like you've probably seen them at a lot of the conferences, right? It's like a really good, powerful demonstration when you get to see the layer that you're injecting in, right? Mostly from an educational perspective, right? That works really well. But then when you start to like correct a vascular occlusion or something, you can actually see the Doppler stop at that point. I mean, it's pretty impressive. So it's definitely something that we're going to be trying to introduce within the clinic as time goes on.
Barbara, I want to move back to something that you said where you said something that I thought was really important, where you have to try to kind of shift the patient's mindset from doing, say, injectables to other modalities. How challenging do you find that can be sometimes?
It is challenging because you know when patients get a treatment, how great they feel after that treatment. Like you do a little feel like, oh my God, that did it. That was the best. But it's not always going to be the best. It's going to start to build up in a way that's not great looking, right? We go to a lot of these conferences and we see a lot of people who are like over-treated, even in our own industry, who have the knowledge and education and can't take their own advice. And it's getting to the point where I'm starting to experiment with some of these treatments too. Like I can only put so much filler in my face now, right? So I think patients, it's true. And plus I had a baby, so like I can't afford any more expansion in my face. The great thing is that Cody and I experience a lot of treatments and share those treatments, right? So whenever we get a new piece of tech in office, like we're the first ones to use it. And I talk to patients about that and they see my results. They say, well, you know what, your jawline looks great. Did you do filler? I said, no, actually I've tried this. Like I'm trying to do it and teach on it. And I find the easiest way to start, having patients, I guess, shift their thinking is through you leading by example.
Absolutely. Yeah, I love that. And it's so true. Because they want to hear it from somebody who's had it done. And if you had it done, then it just speaks so much more volumes. They're like, okay, well, you look great.
Yeah. And so I'm like postpartum, so I haven't had a chance to do much lately, but I'm really excited to do the Morpheus 8 for skin tightening, right? Like I'm concerned about jowls and my jawline. Well, I don't want more filler right now. I want to tighten my skin. So that's the next thing. And I'll be doing it and sharing it and showing my healing process and my results. And I mean, patients like seeing that. They want to see that you're doing the treatments and they want to see your experience and they want to hear like a genuine experience from you and see those results.
And you guys have Halo right now, right?
Yeah, we have the Cyton platform. We have the Morpheus. Those are the two major lasers that we...
Yeah, the energy devices, the energy-based devices that we have. Microneedling with RF, that's Morpheus. And then we have the erbium laser with Halo. And so I find combining those things for acne scarring particularly good. And then, I mean, Morpheus 8 is slotted so well into our clinic for laxity, right? So that skin tightening that everybody's asking for, I mean, when you combine that with fillers, you combine that with something like Sculpture or Radiesse, I find that you're getting some really beautiful results. It seems to like kind of expedite the results, a little bit of synergy that happens between the injectable plus the energy, right?
Yeah, if you can get the collagen stimulator plus using something like microneedling with RF, like it's a really great result.
Yeah.
Oh yeah. And are you doing off face much more, like kind of exploring body a little more?
Exploring. Yeah, we just got the Morpheus, so it's like we're excited to try, right? We're always trying new techniques, making our own blends. And I think that's also where aesthetics is going as well. I forgot to talk about that. I think it's making your own custom treatments. So taking different products, blending them together, pairing them with some kind of an energy device, really making like the bespoke treatment for a patient.
Absolutely. Yeah. Okay. Where are we for our questions? So, COVID. The big in the room. So how has it been for you guys kind of getting back into the swing of things? How has things changed much, or how is it looking for you guys?
So when COVID first happened, we're like, holy shit, we might lose our business, right? Like everyone thought that, right? Nobody knew what to expect. But our manager, Megan, was incredible. And she just kept, she was working behind the scenes, taking calls, answering emails. We launched a promotion just to sell some gift cards and some packages and treatments to keep, the business running as we were going. And we just prepared to be open for any day that we could, right? So the day we got the announcement that we can open, we were open the next day. Like we were ready to go. So it's a bit of an adjustment, but not.
Yeah, actually, like from a clinician point of view, I think it's been a super easy transition. I mean, as you know, it's like, they're kind of slower clinics anyways, right? You're seeing a patient every half an hour. So you just had an extra 15 minutes just to make sure that there's less congestion in the lobbies. And everybody has their own treatment room that they're working out of, right? So you're kind of you get isolated in that area, and so it's really comfortable for patients. And so their feedback is tremendous. They're so happy to come see us. To get in, they need to be on that tier 1 list so they get seen right away. And then when they get here, they're just like super comfortable. And we have all the sanitation stuff that we already have, right? Because you're running a medical clinic. And
these clinics are built for this, right? Like we have individual rooms. No one has to sit in a lobby. You put up a glass panel. We get the protective gear, but like we're ready for it, right? Like everything is completely, you can wipe it down because it's materials that are wipeable. So.
And then some of the good innovation that comes out of this is doing those virtual consults, right? And so we give the option of coming in for a consult live if they want, but if it's not as convenient for them or they don't want to come in, then they can do a virtual consult, which, it's still not the same because you can't pinch the skin, you can't, get that same depth that you get when you're doing an inpatient consult, but it's still very good, right? And that quality that you get from such far away has been a good innovation, I think.
Yeah, I actually am enjoying it. It's definitely been a different, a different twist in it, but I'm enjoying it a lot more than I thought I was going to. It's really kind of great to meet them first virtually, I find, and then when they do come in the room, they're just like, oh, it's so nice to meet you. It's like when they see you, when they come in, and they're like, oh, it's so nice to see you from Instagram or whatever. But it's like having that Zoom meeting too. I thought it was really great, and getting all of that kind of health history stuff, being able to kind of go over that before then it's just kind of they're coming in the room and you just have the treatment done, and makes it so much faster.
Develop like a comfort level up front, so there's less anxiety surrounding the whole like coming to the clinic for the first time.
Yeah.
So much of what we do in clinic is that relationship building. So it's reaching out to them first on Instagram, right? Because that's how they find us and they feel like they get to know you. And now when they're doing like a virtual consult and they get to know you again, and then they finally meet you in person, it's that level of comfort by the time you do the treatment is, you're getting there almost faster because you've made so many touch points with your patients before they even get into the clinic, right? I think that's great.
Andre, I have a question for you. Are you noticing that when patients are coming in now, anything that they've been holding off for a while, they're suddenly doing? Like, I want to do treatment. Like, I mean, it's not like just the Botox. Like, okay, and like now let's finally do my chin and let's finally do my cheeks and let's finally do this. Like, I'm like, whoa, like slow down.
Yeah,
absolutely. It's like everything.
Like they're starved for the cosmetic treatment.
And it's like I've saved all my money over COVID. I haven't been buying anything. We didn't go on the trip, so I'm getting a new chin or something.
Yes, the treatments have become a lot more complex. Yeah, and they want a lot more new treatment areas, and they want to finally get into something they've been holding off on.
Yes, absolutely. We're seeing that.
Yeah,
so much in our clinic at all of our locations that we work at. We're seeing it straight out. It's pretty great.
It's fun. Like it's fun to finally get to do more with some of these people.
It's like we've got a second life, eh? We've got a second chance at life coming out.
Exactly.
We're gonna switch gears a little bit. What about home life for you guys? So like work life, home life, and how does that look like for you guys? I know we touched on it a little bit. 2 little babies at home. You guys are busy.
We're busy. It's hard. It's really hard.
You get a little team happening there, right? You have to develop a team that's going to help you take care of your kids, or else it's just not. Yeah. We need to be at clinic so much that it's you have to
develop a great team in the office and a great team at home. Like my dad's here watching the kids while we're here in the office doing the interview. But I mean, we talk a lot of shop at home. It's too much. Like,
it's hard to turn off, right?
It's hard to turn off. My son, who's 4, is always talking about Botox and cool.
Yeah. He comes up to me, this COVID 15 that I'm carrying right now, and he grabs my belly and he says, "Are you in a cool sculpt?" Like, what? I'm 4 years old. I'm like, okay.
He's very comfortable with that term. Actually, he was in clinic when we were cool sculpting at one point, right? So he like assisted and like learned the process.
Oh,
He's adorable.
I love it.
He comes here for chocolate.
Yeah.
That is so cute.
It is so cute.
Yeah,
Now,
but it's hard to find balance. I think there's a lot of guilt. There's a lot of guilt about being away from my kids, but I feel like a part of this is like I'm doing this for my kids because I'm building a future for them.
Nope, that's a mother thing.
Oh.
It's amazing to be away. It feels great. It's so nice.
It's true. Okay, don't get me wrong.
To be honest, Barb is a total workaholic.
I'm a workaholic.
Like 4 months after having Poppy, and she's like back to work seeing patients for almost regular days at this point, right?
Wow.
Yeah, I know. It's just
actually my mat leave was only 2 months, and COVID screwed me over in that and made me have
true.
2 months postpartum, and I was like, that seemed kind of crazy. I don't know why I decided that was a good idea.
Yeah,
but I mean, it all worked out well.
Isn't it crazy though in life? My wife and I were talking about this the other night, that at our busiest time as parents, we're also at our busiest time professionally.
Yeah.
And it's kind of like we have that, 10 to 15 years of our lifespan where we're probably at our peak professionally. And that's when our kids are at our youngest, and they need us the most.
I know that
absolutely
the hardest. Yeah.
It's a crazy way. Maybe we should have been more like our parents and their parents. Our children a little
that would have been crazy too, I think.
Well, you know,
like,
I don't know about you, but like I grew up with like parents who had us at like 21, 25, and we grew up like in the parties. Like, I just remember like 10 families drinking, partying. We'd have massive sleepovers because parents couldn't drive after that. I'm not sure if that's you guys.
No, it was similar.
Oh yeah.
Yeah. So, I mean, it's just a different life now. It's like we're always working, and our kids.
Yeah, it's just a different life. It's a different life. I grew up with the same life that Barb had.
Like
lots of parties that were going.
Well, let's talk some more work now. I want to breach on the topic of sexual wellness, because I think it's a really important topic, because I think it has this stigma about it that we don't talk about it, and people hold it close to themselves, and it affects people a lot in other ways. So can you talk to us about how you coach your patients through this?
So we're just starting on sexual health, and we're just starting to kind of like put it out there, like just in little conversations, right? Because the next steps are to expand into sexual health.
Yeah.
But just like anything, there's so many things in society have been a stigma. Before becoming a nurse injector, and we know there's been a stigma in the injectable industry, right? People taking care of their face wasn't okay, but taking care of your body was, right? Now, with normalizing it and putting it out there, it's okay to talk about injectables. But even before that, I was a mental health nurse, and before mental health wasn't a sexy thing either.
Exactly,
talked about. And I know it sounds like a weird thing to say mental health became sexy, but it did, because people were talking about it, and there was initiatives. So I think what it comes down to is slowly starting the conversations casually, and then bringing some education into it, and then kind of taking those next steps. And I think that's our plan. We're really big into normalizing this industry, and I think that shows on our social media. And as we move into sexual health, we will do our very best to make it seem normal and fun, and then educate on it.
I love that. And tell us a little bit about the technology that you've got in the clinic and what you're looking to do in that sort of area.
For sure. So as you can imagine, I mean, it's tissue anywhere you can inject, right? So fillers and PRP are the really like the ones that started off with this trend, right? So you go to a lot of conferences, and some clinicians that have quite a bit of experience are really doing a lot of filler and PRP, both for penile enhancement, labial and vaginal enhancements, right? So that's going to be one of the starts of it. But both of the platforms that we have, our radio frequency platform and our Erbium platform, can be used for vaginal resurfacing and improving color and tone of labia and things like that, right? And so that's really where that's going to start.
Like vaginal tightening, lubrication, improving sexual experience, and then PRP also for males and females to bring more blood flow to the area so you can experience sex more, I don't know, in a fun way, because it's supposed to be fun, right? So that's where we're going, and that's why we want to talk about it. And I mean, people have sex, and so people are living longer, experiencing this for longer, and I don't know why we can't be discussing it, because it is very much part of our wellness.
I 100% agree with you. I think
this goes to the concept of it's going to be multiple modalities treating things to the fullest, right? To make sure that patients are experiencing their life fully, right? So the same way that we treat faces, that we're going to be treating sexual wellness as well.
Awesome. So we're sort of coming to the end, but before we come to the end, can you just let us know where in Toronto your clinic is, and how do people get hold of you? What's the best way to get hold of you guys?
So, I mean, our busiest and most exciting platform is Instagram. I mean, that's how we started, and that's where people tune in and watch procedures, and they DM us. And we've also started the show, The After Hours, where we're talking like, you know, a little more spicy things, a little bit off the record. So I think Instagram is the best way to experience our clinic when you're not here. So that's at skinworthy.ca. And we are located in South Etobicoke. So just past High Park, just outside of, just like the border of Etobicoke and Toronto.
Awesome. Well, thank you so much for being on the show today. It's so awesome to have our first couple on the show.
Yes, thank you.
Exciting. And congratulations for this clinic. And next time I'm in Toronto, I'm definitely going to pop you guys a line, because I'd love to come in and see the beautiful clinic and get to see you guys in person. And good luck with the little one. Wow. It's so exciting.
Well, thank you for having us.
It was wonderful. It's a great chat.
Yeah, appreciate that, and have a great night, guys.
Yeah, great night. And we're going to get you on again as well. We'll get you on closer to the winter, and we'll catch up with you and see how you're going then.
Yeah, for sure.
Perfect.
That's great.
All right. So just a big thank you for everyone for tuning in tonight. Don't forget to follow these guys at skinworthy.ca. Don't forget to follow us at Skintox Canada. And we look forward to reaching out to you next week when we will have our next show. If you like what we're doing, share, post, talk about it with your friends. We'll keep bringing the content if you guys keep liking it. So thank you, everyone. Good night. Have a great Father's Day, all you fathers out there, and have a wonderful weekend in this beautiful sun. And we're almost fully open again, which is great.
Thank
We'll see you guys later.
All right. Cheers, guys.